Thank you, and good afternoon. Our forward progress in terms of reopening continues. We'd often talked about turning the dial, and today we are turning the dial. Additionally, per the governor's direction and order today, they are reopening and adding the following categories of business can be open in San Diego County. Office-based businesses. We continue to encourage telework, strongly encourage that where possible, but for individuals who need to be physically present, office-based businesses can resume their operations. Malls, this is just clarifying that both regular traditional malls, outdoor malls, outlet malls, strip malls, any configuration of mall can be open, but again, it is only for pickup or for delivery purposes only. So no in-person shopping, but all of those malls and associated retails can be open for pickup services. They've also added selective services that are able to be open. These include car washes, pet grooming, landscape and gardening. In addition to those, they've allowed outdoor museums and outdoor gathering spaces. All of those are be adding to the Stage 2 reopened businesses. We do ask that each of these businesses go to the county website and fill out our safe reopening plan. Simple document you download. You post that publicly as well as make it available to your employees. And with those conditions met and understanding the criteria outlined in there around hygiene, physical distancing, health screenings, and the other various components of those plan, those entities are cleared to resume operations in San Diego County. Again, office-based businesses, strong encouragement for teleworking where possible, but for employees where that does not work, can be present. Malls, both regular outlet malls, strip malls, are available for pickup only. Selective services around car washes, pet grooming, landscaping, and gardening. Those services are open, along with outdoor museums and outdoor gathering spaces. The governor today also began to issue some guidelines for businesses that are not yet open, but they want to prepare. They issued guidelines for the restaurant industry, in particular for in-person dining. For San Diego County, this is just further things to think about as we anticipate and look forward to that further reopening. Those are not reopened at this point, but the state of California has issued guidelines for a number of industries for things that they should consider in their planning efforts in terms of what they're doing. This reopening phases that we continue in coincides with our continued efforts around testing, tracing, and treatment, which is a vital cornerstone of what we are doing. And we continue to build up our supply chains for all the various components that go into executing those tests, along with working out all the protocols and procedures for how people can best get entry point into the system, access the test, and how we can properly coordinate this with all of the various entities that are a part of the testing team and testing effort. We also continue our efforts around personal protective equipment. We want to continue to ensure that our frontline workers, our healthcare workers, our nurses, our first responders have the protections that we need. I believe we are now up over 3.6 million individual items of personal protective equipment we have distributed, and we continue to push to acquire and distribute more with all of those. And all of our efforts around ensuring the capacity of our healthcare system continue, both monitoring ICU utilization and total healthcare system capacity. To date, we have done a really good job as a region in terms of coming out this. We want that progress to continue, and we want to continue to move forward in terms of meeting our goals and everything that is out there and everything available to you. Before I jump into the testing slide, I just want to share with you that in San Diego County, we still have 3 state testing sites where any individual can make an appointment. I'll share the slide in a minute with the website and phone number that you will call to do those. But each of those sites are operating daily, conducting just under 800 tests a day. We ask if you make an appointment, you please fulfill that appointment. If not, you're taking a spot that someone else could have utilized. But the locations presently are at Grossmont College, the county's North Inland Livewell Center in Escondido, and the former Sears building in Chula Vista. Please don't show up at those sites if you don't have an appointment, but they are geographically spread throughout the county. And again, we believe those can do just under 800 tests a day. In addition to those sites which you can access without a doctor referral, you just go to the website or call the number and sign up. We're continuing to ramp up our county testing through our public health lab. We were working with our LiveWell mobile office at testing sites in Southeast San Diego. We're also sending out the county's library bookmobile and other county vehicles to testing throughout the region, looking for hot spots or particular areas Our targeted efforts around skilled nursing facilities continue, and we continue to take a multi-pronged approach to try and daily increase the amount of testing that we're doing. Quick update on the homeless at the convention center. 138 more tests were administered yesterday. We've now administered 1,126 tests to date. The totals presently are 359 staff have been tested. That's up 17 from yesterday. And 767 residents have been tested. That's up 121 from yesterday. The only change in the numbers is we have 2 new negative tests from what we reported yesterday, but no other change. With that, we will jump into our slides and move through these quickly. Yesterday, we were reporting 2,440 tests conducted. Again, a little bit of a lag coming out of the weekend. We expect these numbers to uptick. We're now over 84,000 tests total. We added a few more contact tracers and case investigators. We're now at 170, and we are expecting these numbers to continue to grow and move up towards our initial goal of 450. We expect the number we need will be more than that, but we will assess that as we see an increase in testing capacity and testing goal. We'll also have an increase in our contact tracers. You see 6,294 tests performed. We're currently treating 195 individuals in our public health motel rooms. Those rooms remain available to any San Diegan who has a positive test, who does not have the ability to isolate at home. And we continue to work with our healthcare system partners to let them know of this available resource and ensure that they are sharing that with their patients who might need that service. Next slide, you're going to see this is the chart reminder. We've shown this before. If you'd like to sign up for the available state testing, you can go to the website listed there, lhi.care/COVID testing. Fill out the information, and they will direct you to an appropriate appointment at the geographic location that is most convenient for you. You do not need a doctor's referral. You do not need insurance. You do not have to pay. You simply have to go through the process of signing up. You also can call the number there, 888-634-1123, to schedule an appointment. Today we're reporting 96 new positive COVID-19 test results. That is out of the 2,440 total that I mentioned on a previous slide. That is a 4% positive rate. Our rolling average for the preceding 14-day period is 5.1, and so today's total are a little bit below that. Again, one-day totals are not indicative, but the general trend that we are seeing here is trending in a downward trajectory as a percentage of positive. We expect that downward trend to continue as we continue to expand testing and as we continue to do more testing. We're down a little bit yesterday and today, a little bit of a lag from the weekend, along with a little bit of a lag for commercial labs reporting their segment of the reports. But we do expect these numbers to get back up in the range that we saw last week and continue to increase towards that initial goal of 5,200 a day. Daily hospital census is reasonably unchanged from yesterday. 144 ICU patients, 400 cumulative hospital patients that are COVID positive or COVID suspected in our area healthcare systems. And again, this is generally flat if you take into account the added hospitals that came into our system back at the beginning of the month. Moving on to the next chart, you will see our 400 COVID patients in our hospitals at the bottom, 3,694 total hospitalizations in San Diego County. And again, you can see that relative to current bed capacity, the dotted purple line at the top. Final chart is just our cumulative stats, 5,161 positive cases who are there. You see our estimated recovery at 3,124. Cumulative hospitalizations with a doubling rate every 35 days, cumulative ICUs with a doubling rate of every 41 days. And then we are reporting 15 additional deaths today. Those are 15 lives and 15 families who have been struck by this, and we extend our deepest condolences and sympathies to all of them and deepest thoughts to all of their families. With that, I will turn it over to Dr. Wilma Wooten for today's Public Health Officer's Report.